In this video, I am going to give you 20 best advices to pass Plab 2. If you keep these advices in your mind before your exam, I am very hopeful that you will clear your Plab 2 exam on your first attempt. Personally, I have found these tips very useful when I was preparing for my Plab 2 exam. Let's start. First and most important advice is that to pass Plab 2, you need to depend on your interpersonal skills and communication skills, not on your medical knowledge. This is very, very important advice. It is very important that you learn how to communicate your knowledge to your patients with right level of empathy and sympathy. Plab 2 is more an assessment of your communication and interpersonal skills than your medical knowledge. This is more true in ethical and counseling stations. These scenarios are all about your interpersonal skills, your tone of voice, facial expressions, and gesture. So work more on developing your interpersonal skills and communication skills to pass your Plab 2 exam on your first attempt. Next advice is, before your own Plab 2 exam, keep yourself updated with new stations from previous few exams, because many stations are repeated again and again. So before your exam, you should keep yourself updated with recent new stations and keep preparing for those as well alongside your previous preparation. Next advice is that don't try to show off a lot of knowledge and don't vomit your knowledge during your Plab 2 exam, because as I have explained to you that this is not about your knowledge but how you apply your knowledge in that particular situation and how you communicate it. So even if you know everything about a particular topic, it is not guaranteed that you will pass that station unless you address that particular patient's ideas, concerns, and expectations, in addition to their physical problem. Your management must be based on eyes and your physical findings. Patient's physical problem is as important as patient's social background, patient's psychological background, patient's own ideas and concerns and expectations. Unless you address these, your knowledge is not going to help that patient. And never forget safety netting when you are doing your management part. Another very, very important thing is that before your exam, you should have good night's sleep if you want to perform well on the day of exam. Similarly, having a good breakfast, high calorie breakfast on the day of exam is very important. You need a fresh and a brain full of energy, because you will be in a stressful situation. You will be performing for many stations in a row. So you need a good night's sleep and a good breakfast on the day of exam. Next important advice is that on exam day, you should stay calm and composed. it is very important to realize that nervousness or anxiety will break stream of your thoughts and you will not be able to think logically, resulting in lower performance quality. On exam day, you need to show confidence, perform naturally, and convince the examiners that you are a good doctor. Another very important advice which you must keep in your mind that in Plab 2 you are a junior doctor. So never behave like a consultant. Always remember your limitations as a junior doctor when describing your management plan. Involving a senior is very important in complicated cases, so you have to mention it appropriately where indicated. If you are doing everything on your own, even in a serious situation, you are not a safe doctor, so you will not pass your station. Next advice is that use 1.5 minutes sensibly. This is the short time given before starting the station. So you must use this smartly and quickly read the station and try to comprehend it to figure out what are the main tasks given in the scenario which you have to perform and address. But remember, if you forget anything about the scenario when you are inside the cubicle, there is always a copy available inside and you can read it again. You will not be penalized for checking it again. But before entering the cubicle, you must read the scenario carefully because they keep changing some tasks, some issues in stations. So it's never the same from your notes. So you have to think about that station when you read outside the cubicle and try to comprehend what they are asking you to perform. Another thing about when you read scenario outside the cubicle, try to understand that in this scenario, whether you are asked to explain your management plan to the patient, sometimes they ask that explain your management plan to the examiner. And another important thing is that you should be aware that where you are when you are performing in this station, whether you are you are a junior doctor in GP practice, or you are in emergency, or you are in a ward. So read the scenario carefully and do exactly what you are expected to do. When you enter the cubicle, especially in mannequin and simman stations, you should always look around inside the cubicle to look for any cues such as equipments, type of mannequin placed there, oxygen cylinders, breathing masks, medications. If there is BNF, you might need to check BNF. There might be ECG and chest X-ray on the wall, maybe on the side wall or on your back, and there might be other test reports with the examiner. And you should look for all these cues. These will help you to manage your station according to the requirement and expectations. Next important advice is that in combined station where you have to take history, perform examination and do management, time management is very vital, the most vital thing. So in a combined station, don't spend more than 2 minutes on history taking and then move on to examination and finish your examination at 5th or 6th minute and start the management part. If you spend more time on history taking, you might not finish management in time and you will lose 4 marks altogether. Another very important advice is that speak at a moderate pace. Some candidates they speak too fast, but don't speak too fast, don't speak non-stop. It will lead to failure. Speaking at a reasonable pace is better and keep your patient involved. Don't try to rush and finish the station quickly. Lab examiners want to observe your performance as a whole, not just how much you speak in 8 minutes. Engaging your patient is even more important during the management part. So, after every few sentences, ask the patient, is it okay? Are you following me? What do you think? Keep your patient involved in the discussion in a two-way style. Key message here is that your consultation must always be patient-centered, not doctor-centered. You will definitely pass Plab to examination if you address eyes and your consultation is patient-centered and you involve and engage your patient and manage their problem from all aspects. Then key advice for history taking. In history taking, the most important issue which examiners note are its structure and logical sequence of questioning. So it's better to ask questions about one system first, then move on to the other system and so on. There should be a sequence. And most importantly, do not fire a lot of questions at once. Give time to the patient and go with the flow of the consultation. Next important advice is that exclude red flags and emergencies first when you are taking history. In Plab 2 scenarios, you don't need to go through a long list of differentials. You just need to rule out a few red flags and emergencies, especially the life-threatening emergencies. Take a very focused history to exclude the most important differential diagnosis and try to reach your final diagnosis. There is never time to exclude each and every differential. Time flies during a Plab 2 exam. Then many candidates, they totally forget mentioning on performing examination. Examination is a part of data gathering. You will miss some marks of data gathering if you don't perform or mention examination. It is an essential requirement for all stations, including ethical and counseling stations. Even if not asked in the scenario, you are supposed to do it or at least mention it. For example, a mother comes to talk to you about her sick child. So during consultation or at the end of consultation, you need to mention that I need to examine the child. Can you bring him next time? So somehow you need to show to the examiner that examination is part of your data gathering. And it is also very important that you don't forget to take consent before performing examination and also mention chaperone to show the examiner that you also familiar with the ethical and legal issues of medical practice. So before performing an examination, never forget to take consent from your patient and take care of their comfort and dignity. And do mention chaperone, especially in intimate examination scenarios. Another good advice is that when you are explaining your diagnosis to the patient, never give false reassurance. Openness and honesty is very important in UK medical practice. So before giving any reassurance to a patient, first take a detailed history, do all relevant examinations, look at the available test reports, and then do any reassurance if appropriate. Never give false reassurance or never make any false promise to your patient. And for breaking bad news, follow a proper structure, which is spikes. You can watch my other videos about breaking bad news. Another very useful advice is that in some scenarios, simulator is not cooperative, or you feel that simulator is not opening up. They are not giving you required information. So if a simulator is not cooperative, especially in combined stations, don't spend too much time on history taking or trying to open the simulator. Usually it means that they want us to start doing rest of the station straight away rather than spending time on history. Just ask 3 or 4 important questions and then quickly move to perform the procedure or examination. Because time is very short in combined station and you have to perform a procedure and complete management part as well. For Simman stations, my advice for you is that go systematically. Try to ingrain ABCD approach in your mind for Simman stations. When you enter the station, first ask a few relevant questions. Don't take a detailed history. Then start assessing the patient by ABCDE and manage accordingly wherever there is problem with A, B, C, D, or E. Mention necessary investigations and your management plan. And in Simman stations, usually these are emergency situations. So mention that you will involve your seniors at appropriate time. In Simman stations, test reports are with the examiner. You have to ask for those investigations, and ECG X-rays may be on the wall behind you. So unless you mention investigations, examiner will not hand over or will not tell you that there is ECG or chest X-ray on the wall. So this is my advice for Siemens stations. For mannequin stations, key point is that in addition to the advice given for combined station, never forget safety precautions such as washing your hands, wearing gloves and gown, disposing of needles in the shop bin and other waste in a general waste bin. And also covering the mannequin at the end of the station is very important. Give dignity to the mannequin as you are dealing with a real patient. And a very, very important advice is that don't fail any station badly. Even if you struggle in some stations, try to perform well as much as you can so that you can get at least some scores. It has happened with some unfortunate candidates that they pass the required number of stations but fail the exam because they were not able to achieve the minimum required passing marks. Keep in mind that to pass Plab 2 exam, you need to pass the required number of stations and achieve the minimum passing score as well. So this was my final advice, and I hope you find this video useful. And best of luck for your exam, and don't forget to subscribe to my YouTube channel where you can find many more useful videos about Lab 2 preparation. And if you follow these advices, it will be very easy for you to pass Lab 2 on your first attempt. Thank you and goodbye. You have received a young man known to have